Hello friends, today I'm going to talk about airplane ear and ways to prevent it. So first I will talk about airplane ear and then I will talk about the pathophysiology behind airplane ear, and in last I will also talk about like different ways to prevent it and in which all condition we should not plan for a flight. Okay, so first of all, let's see what is airplane ear. So many times, like while flying, one may feel some kind of discomfort in terms of ear fullness or ear pain, or it can be heaviness in the ear, like that. So why actually it happens? So first of all, I'll talk about the pathophysiology of airplane ear. So it's very important to equalize middle ear pressure with the atmospheric pressure. Any difference in middle ear pressure and atmospheric pressure can lead to some kind of ear discomfort or ear pain. So in our auditory system, we have a special tube called eustachian tube, and actually the eustachian tube helps us in the equalization of middle ear pressure with the atmospheric pressure. But what happens like during takeoff or during landing, there can be a like sudden change in air pressure, and because of that sudden change, our eustachian tube may fail to equalize the air pressure between middle ear and atmospheric pressure. So let's see what actually happens during takeoff. So during takeoff, so here you can see the picture of takeoff. So during takeoff, the atmospheric pressure gets lesser than middle ear pressure. So that leads to bulging of eardrum, or you can say tympanic membrane, and that can that can lead to some kind of ear discomfort or ear pain. The reverse thing happens during landing. During landing, the atmospheric pressure gets larger than middle ear pressure. So when the atmospheric pressure becomes greater than middle ear pressure, and then that leads to the retraction of eardrum, and that can also be a condition of ear pain or like ear fullness and all. So let's see. Now I'll talk about like the different ways to prevent it. So so there are many ways, like you can suck sweets or you can have some chewing gums with you. You can perform Valsalva maneuver. I will tell you about Valsalva maneuver later in this video. You can stay awake like when the plane is descending to land. Have a drink, ideally through a straw or a sports bottle. You can yawn or open your mouth widely as if you were like yawning. So now I'll talk about the Valsalva maneuver. So you can pinch your nose close with your fingers and blow through your nose until you feel like your ear pop. So that's actually the Valsalva maneuver. For younger kids or for infant, you can give a dummy to suck or a drink from a bottle, and you should make sure that they stay awake for takeoff and landing, as they will swallow less while sleeping. You should encourage them to yawn frequently, and you can use some kind of nasal spray also. So this is a picture of Valsalva maneuver. So you can see like how this girl is pinching her nose and like puffing, like doing puffing through her cheek. So like that, you can also do a kind of Valsalva maneuver to avoid some kind of your discomfort in your. Now there can be another question, like many times patients ask like, can I fly with an ear infection? So it is advisable not to fly when you have especially otitis externa or otitis media, because flying in these conditions may lead to severe pain. So we recommend not to fly if you have such kind of uh, ear disorder. Now like if you are planning for a travel during such kind of infection, then you should talk to a doctor, and then they will tell you how you can like minimize the discomfort caused by ear pain and all. So they may recommend you some kind of medication to like which can open your clogged eustachian tube. So it's always better to avoid flight when you are suffering from otitis media or some kind of ear infection, and you can follow all these tips to avoid discomfort or ear pain or oral fullness during your flight. Thank you. See you in the next video.